Good morning. Just wait for a few more attendees and then we'll go ahead and get started. So Liz, do you want to drive or do you want me to drive?
You are already set up, so why don't you go ahead? Does that work?
Just give me the clue if I'm not moving it fast enough.
Sounds good.
Okay. All right. So let's go ahead and get started. We want to be sensitive to everyone who's attending to your time. And we want to give a special shout out to Northrop Grumman Federal Credit Union, our partner of the past 22 years plus. Time flies when we're having fun. So today's presentation is about Medicare. And we're going to jump in here in just a minute, but just wanted to give those who don't know us some highlights on this long-term partnership that we've had with Northrop Grumman, and to those of our clients who are on. We have attendees from really across the country today, which is wonderful. So this is a subject that gathers a lot of interest, wouldn't you say, Liz?
Yes, I think it, and I also think it's the timing is good, just from I feel like every time you turn on the TV or the radio, or it's open enrollment time. So I'm sure that's where a lot of people are getting bombarded, for lack of better words, of what you should and shouldn't do. And hopefully we can bring some clarity to that today.
Exactly. So again, I'm Margie, this is Liz, and we are Blue Heron Financial Group based out of Annapolis, Maryland. And we are celebrating our 25th year this year. Again, that's just kind of crazy. But let's go ahead and jump in here, and just to set the tone, we're not going to be able to answer questions while we're presenting, but if you have questions, on our last slide, there will be a contact that you can reach out to Debbie here in our office. And by no means are we professing to be Medicare experts. However, over the course of time, there's a lot of ancillary areas to what we do in the financial planning world. And we used to say, what, 10 years ago, maybe it's longer than that now, we really didn't get so much into Medicare, but over the course of the past decade plus, it's really important that we as financial planners understand and explain to you, because some of the decisions you'll have to make in retirement will impact Medicare and vice versa. So I'm going to go ahead and jump right in here, and then I'm going to turn it over to Liz, who's going to get into the guts of it, and then I'll close you out. And again, we'll be sensitive to your time. I would expect we'll probably be 40 minutes, perhaps longer, we'll see. All right. All right, so I already described what we're here to do today, and that is to get some more knowledgeable about Medicare benefits. And then for today's agenda, I'll go ahead and touch on top concerns of pre-retirees and retirees. Many of these will likely resonate with you. The cost of healthcare. Fidelity runs an ongoing, and has for many, many years, what that tab looks like for couples in retirement and singles in retirement. It can be a little staggering. As I mentioned, Liz is going to get into the guts of Medicare, but then also touching on Medigap and what is that, and then pros and cons of traditional versus the other options that are out there, the cost. And I mean, we dig into this all the time, but I think there's sometimes surprises on the cost, and not to be repetitive, but how retirement income comes into play affects what those Medicare costs are. And we'll talk further about that. The enrollment period, as Liz mentioned, that's where we are right now. Considerations. Sometimes it looks like, hey, this is a more cost-effective plan. Maybe we should go that route, but we really want you to stop, pause, and consider a lot of different elements. And then some resources for you. Ironically, because my husband is on Medicare. Guess what came in the mail? And this is the Medicare and You. It's published every year. I've thumbed through here. It really tackles a lot. So this is kind of your encyclopedia about Medicare. I feel like I'm doing an advertisement here, but truly there's a lot of good information to consider there.
And I think you can actually download that. So if you're not on if you're not on Medicare, I believe you can download that on the Medicare website.
So I wasn't aware of that. I'll have to take a look at that. So top concerns in retirement. We even have a sign in our office in the conference room that says, "Can I retire now?" And this is what we're tackling. Okay, are things lining up so that you don't outlive your resources? So that's certainly a big concern in retirement. Investments, we could do a whole presentation today about the markets. This year has been difficult, but we've got to keep perspective always. We always know it is not a straight up shot, and we've had some excellent years, and then we'll have some negative years, and how does that all play out over the long haul? But right now, for those considering retirement, it really is important to look at how markets are affecting those balances. And then the rising cost of medical expenses. We have our cash flow worksheet that we are more than happy to send out. And that's probably, wouldn't you say, Liz, the one area that folks, not to say they get it wrong, but they really underestimate what that cost will be.
Yeah, it's really interesting. I would agree. So oftentimes we're asking for, like, what does it take for you to live the life that you're used to and to really be yourself and enjoy life? And when we get those worksheets back, and I say worksheet because we don't like to call it budget. I think sometimes has a negative connotation, or expense, tracking your expenses. It's really just trying to give us an idea. What is your lifestyle cost? And one of the subcategories is medical. And sometimes they'll come back with 0 because people are so sheltered because they're used to having it come out of their paycheck and it's just not on their radar screen as a monthly expense, or there'll be a big question mark, or, Margie and I are helping to guesstimate from a lot of experience and having seen what people are paying for medical coverage in retirement. So it's all over the board. It's interesting.
It really is. And I think when we lean into that and the surprise and that's just, again, a value add of having Blue Heron kind of weigh in on what that eventual retirement looks like. And then the last one here, if you are in a couple situation, what is retirement going to look like when one of a couple passes on? And there's a lot of consideration here. I won't get too stuck, but when pension elections come up, that's a big area of contemplation, and we dive into that. We have to be cognizant of the fact that when one passes, there's a step up to the higher Social Security, and one is going to fall off. And really, between those two, income can be significantly decreased. So these are the top concerns as they were relayed through a retirement confidence study. So I would be curious how many of these resonate with you. So I mentioned that there's this this cost, and even as I look at this, the annual healthcare cost per person at this $6,772. Now that's average. So let's keep in mind that this is throwing, for example, federal employees. Their medical coverage is different than the private sector. So that's an average. I think it's underestimated, quite frankly. And as far as the overall percentage of spending, so when we throw in food, and yes, we'll throw in the fun stuff like travel or gardening, utilities, if there's mortgage, that healthcare cost makes up greater than the 10%. So that's definitely significant. And then this number is a bit mind-boggling when you think about a 65-year-old couple retiring this year would need $300,000 to cover health care and medical expenses throughout retirement. So this is throwing, as it says also, those are just out-of-pocket costs beyond Medicare coverage. So it's a staggering number, and that is including a lot of different areas, but it's hopefully giving you some pause there to be thinking about how is that going to be tackled. All right, so what is Medicare? That's the federal health insurance program, and it's been around for decades, and there's a lot of back and forth. We hear about this, especially come election time, Social Security benefits, Medicare benefits, and is it going to continue to be there? We get that question frequently, and our response is, well, we got to go with what we know today, and certainly there can be changes coming about. But it's for those who are age 65 or older, but it could also apply for those who are disabled. And there's different parts. This is where I'll refer to the alphabet. So 3 parts, A, B, and C. And then there's a D, and that's the drug part. That's the easiest one, right? D, drug, got it. The others are not quite so simple. And then we'll dig into the Medigap or Medicare supplement. Just a little footnote here, we hear a reference at times to Medicaid as opposed to Medicare, and there's a big distinction between the two. Medicaid is not likely to come into play unless someone is at poverty level. I mean, that's so just erase that from your vocabulary. What we're talking about today and diving into is Medicare.
Yep. So eligibility, I'll jump in. Thank you, Margie, for the introduction. And to Margie's point, so Medicaid is purely needs-based. Medicare is what most Americans are going to fall under. So eligibility, age 65 or older and disabled for at least 2 years. And I'm 99% certain that that disability is qualified by Social Security. So let's just say you have a work policy that qualifies you as disabled. That is, you have to be qualified as disabled by Social Security. You also have to qualify for Social Security benefits, but that does not mean that you have to be collecting Social Security. So more and more, Margie and I are seeing folks wait until 70 to turn on their Social Security because they're getting those big raises. But that doesn't mean that you have to wait until age 70 to get Medicare benefits. You can be eligible based on your spouse or former spouse's eligibility. It's usually 40 quarters of work. About 10 years is what that works out to be. Go ahead, Margie, if you don't mind. So let's talk about the parts. And again, this is going to be kind of painted with a broad picture. But Medicare Part A is purely hospital insurance. And this is the one that is free. So oftentimes we hear, I have to sign up for Medicare Part A the second I turn 65. And why wouldn't I anyway? Because it's free. That is hospital insurance, hospital stays, skilled nursing care. That's a little bit deceptive because skilled nursing care, home health care, and hospice care all have very limited coverage. So yes, there's some coverage for the first 30 days at some level, then the following 30 days at another level, but I believe it's 120 days total that there's any sort of coverage, and it's a dollar amount per day. So don't think about it that Part A is going to cover 100% of those costs by any means. Part B is think about this like your preventative medicine, your, well checks, diagnostic testing, outpatient therapy, PT, all of those regular doctor's appointments, not those hospital stays that you're going to go to. So again, Part A is free. Part B, there's a premium. We're going to talk about that too. Part D, to Margie's point, again, this is kind of the easiest one for all of us to remember because it's drugs, it's prescription coverage. So it helps to cover that prescription drug cost. You may have heard a lot about this donut hole. It is to be phased out, if not already. It's provided through private companies, and I think that's important too. So it is not government. It's not run by it's not provided through the government like A and B. It's run through private companies. It is voluntary enrollment, and you have to be enrolled in parts A and B in order to get D, but you also have to enroll during that initial enrollment period. So I'll pick on my grandmother. She's not on here. You know, she is thrifty, let's say. And when she saw that it was going to cost $13, you know, 20, maybe 19 years ago, she never signed up. And so because she never signed up, now it would be a really hefty penalty because she doesn't have that Part D. So it is something you want to address at the time you're signing up for Medicare, in our personal and professional opinions.
Yeah, isn't it, I could be wrong on this, like 10% per year?
Now that's Medicare Part B. I think Part D is 1%. It might be 10, either 10 or 1. I think it might be 10.
Penalty no matter.
Per year, for life.
Yeah.
So Medigap, this is what Margie touched on as alphabet soup. This is like F, G, LMNOP plans. These are also provided from private insurance companies. Premiums vary by company, coverage, and state. So it's really important to look into the different providers. Generally does not cover long-term care, dental, vision, hearing aids, eyeglasses, private nursing, all of those things. One thing on the credit union does offer retiree dental and vision coverage, which is really important and something you want to consider, because traditional Medicare, which is A, B, D, and then this Medigap or supplemental policy, will not have any coverage for those. You can buy a Medigap policy during the 6-month open enrollment period, and any standardized Medigap policy is guaranteed renewable even with health problems. And this is a really big one that Margie and I feel like is not talked about enough, but you know, our health is our biggest gift always. We all know that. And thankfully, we can all get coverage regardless of pre-existing conditions. But let's just say that you chose not to go with a Medigap policy initially, or you decided to go with Medicare Part C, Medicare Advantage. We're going to talk about that separately. And then down the line, you decide to come back and say, oh, wait, I made a mistake, or my life has changed, and now I want a Medigap policy. If you were not already in a standardized Medigap policy initially during that initial open enrollment, then you can go through underwriting. So I believe you can still get coverage, but you may be penalized in terms of pricing to say, hey, well, you didn't have a heart condition 10 years ago. Let's just say you had the heart condition, you signed up for Medicare supplemental policy the day you were eligible. They cannot penalize you for that. They have to underwrite you, and it has to be a normal premium, versus if you decide to go at a later date and they say, hey, you're coming back to us, but you have a health condition, then you could pay significantly more for that coverage, which is, again, really important to know. So I just touched on this. There's 10 standardized plans. Plans cover costs like co-payments, co-insurance. So oftentimes you'll hear of the 80-20, and the Medigap policy is to help offset that 20%. Standardized plans must all offer the same benefits. So that's really important too. So Plan G with AARP versus Plan G with, I don't know, Aetna. Yeah. You know, they have to offer the same benefits. What we encourage you to do is talk to your doctor, talk to your friends. Customer service is it's a thing of the past, unfortunately. But I mean, if you have an issue, you want to be able to call folks. You know, you want to be able to pick the phone and get a hold of somebody. And same with your healthcare provider. So you know, for example, that you love your primary care, we'd encourage you to start with their frontline folks and say, you know, who do you have good experience with? Who offers good coverage? And go from there. Cost is generally the only difference between the policies. So again, cost and then customer service, we think, are the two things that will differentiate plans. Some states, I don't know if we have any, we do have some folks from these states, Massachusetts, Minnesota, Wisconsin. So they're standardized in another way that Margie and I will not profess to understand. Part C. So Medicare Advantage Part C is separate. This is Medicare Advantage is separate from traditional Medicare. So again, traditional is A, B, D, and then a supplemental plan. Medicare Part C kind of wraps all of those into one. Oftentimes can look really attractive because it's more similar to what most of us know in our working years of just a one plan, everything's in one bundle. So again, it can look attractive from that standpoint. Coverage is provided by a private insurance company. It covers, you get all the coverage of Part A and Part B. You still have to pay that Part B premium, but you can also get other benefits like dental and vision, and we'll talk about that. And costs also vary by plan. So Medicare Part C, these are a lot of the different types. HMOs and PPOs are generally the most familiar and the most common. And this is another point that I don't want to say caution, but just to go in with your eyes wide open. HMOs are going to be very provider driven. So we live here in Maryland. Hopkins is a big provider. So Hopkins may have their own Medicare Part C Advantage HMO plan, which basically says you can come to all of our Hopkins doctors, but the second that you go outside of the plan, you're going to need a referral. We are likely not going to cover any or all of the expenses. PPOs is a little bit more flexibility, but again, they're going to be privatized plans where you might have more restrictions in terms of who you can see. And again, we're not experts, but what we caution our retirees on is if you're going to be traveling in retirement, which a lot of folks want to be, and you get sick elsewhere, there is some urgent care emergency clauses, but you want to really make sure you understand, if I have this private Medicare Advantage plan, what coverage do I have if I'm on a riverboat cruise on the Rhine or visiting family in Florida? So just to be really aware, again, the private fee-for-service plans, special needs plans, medical savings accounts plans, those are pretty unique, but they are options. Original Medicare pros and cons. Again, original, I'm going to repeat myself a lot just because I know for myself, sometimes I have to hear it 10 times. So Medicare, traditional Medicare, original Medicare is A, B, D, and then your supplemental plan, which is like F through L. So flexibility of doctors and hospitals, back to that whole travel situation, they're portable. You pick and choose coverage, and again, you can take it with you. The cons are that it's 80-20. Unless you buy that Medigap policy. So that Medicare gap, that Medigap, that supplemental policy, the goal is to help hedge against that 20% coverage and set an out-of-pocket maximum. More coverage generally means higher premiums. Another con means that there's no dental and vision. Again, the credit union does offer retiree dental and vision plans. Another place that we would encourage you to talk to your doctors, talk to your dentist, talk to your ophthalmologist.
Yeah, and that again, I mean, we're not here to say original versus the C plan. We're just here to say be cautious.
Mm-hmm.
Don't get stuck somewhere that you don't want to be, and what might look like it's cheap on the front end may end up being a lot more expensive to see specialists and whatnot.
Yep. So Medicare Advantage pros and cons, all healthcare is in one package. Again, you're not trying to track down, especially if you're not on Social Security. If you're not on Social Security, then you're paying your Part B premium quarterly. Then you have to pay your Part D premium, and then you have to pay your supplement premium. So you have different premiums to pay versus for Medicare Advantage, it's one private company that you're writing a check to. Dental and vision can be included. And again, it has out-of-pocket maximum set from the get-go. Cons, and again, I think we've touched on this, but it's good to repeat. If a doctor or hospital is out of network, additional out-of-pocket expenses could be incurred, limited to PPO or HMO, and it's limited to what the plan allows. So again, if they say, I'm not going to get into that, but again, they can be more limiting because they're private, not government run. All right, so let's look at costs. And again, Margie touched on the expense worksheet and just really getting a handle on what does it take you to live the lifestyle that you're used to and the life that you want to live in retirement? So let's just say, you're working lots of hours right now and in retirement, you want to travel. Well, then let's put that extra travel expense in there. And to Margie's point on the slide earlier, medical has become a big piece of this equation, and we have to have some accurate estimates. We can't say it's going to be $250 a month per person. But on the flip side, we don't want to assume too high of a number either. And back to those expenses, it's an important exercise really at any stage in life. But oftentimes I feel like Marge and I are having to justify why we're putting these higher numbers in for medical, and they're like, there's no way. But let's just walk through some examples and show you. Again, Medicare Part A is free if you've met that 40 quarters. I don't know if I already touched on this, but just keep in mind, Medicare Part A, if you're still working and you're 65, there is a lot of noise that says you have to sign up for Part A. That is not true. It is certainly an option because it's free. You just basically have duplicate coverage between you and your current employer. But if you have a high deductible health plan and you're contributing to your health savings account, Marge and I are huge proponents for your health savings account. So if you have the option to do the high deductible plan and contribute to your health savings account, we highly encourage you to do that because, as you saw earlier, you're going to have $300,000 in medical costs. So, we always say you will use that money. You will love having that money. It's the only place you can get triple tax-free money right now. It goes in pre-tax. You don't pay taxes on it. And so long, it grows tax deferred. And then as long as it's used for healthcare at some point, then it's tax-free, which is a beautiful thing. So Medicare Part A, if you register for Medicare Part A, you are no longer eligible to contribute to that health savings account.
Yeah, and Liz, I think that there's a time frame. You've got to get out of the HSA. Is it 6 months or 2 months? Yeah, we'll have to.
It's 6 months. And that's an accountant question. So we just had this conversation with somebody else recently. If they want to retire in June or July, what if they just max fund their health savings account in January? Again, that's between you and your accountant in terms of how that works. But there is a 6-month period, to Margie's point. At whatever point you want to sign up for Medicare Part A, there is a 6-month look back on the health savings account. So again, Medicare Part A is free. Medicare Part B, the minimum is $170 per month per person. And this higher if subject to IRMAA. We're going to get to that. IRMAA is income related. So it's basically saying, okay, your Medicare Part B and D premiums are both subject to your income. And we're going to talk a lot about this. It's something else that Margie and I are seeing on a daily basis that's really important to think about, plan for. So Medicare Part A is free. Medicare Part B at minimum is $170. Part D average is about $33. And then the average Medigap policy is $145, let's call it. So bare bones, minimum situation, you're on Medicare, you're going to pay, let's just call it $350 a month per person before you walk into a doctor's office.
Yeah, I'm going to just add one thing. It is and it's not Medicare related. But when we're talking to folks who are wanting to consider retirement before age 65, and by no means are we trying to dissuade them. However, this is a big nut to crack on the medical before Medicare. And I just want to reiterate again what Liz said. This number here, the $347.60, is the minimum on the original Medicare plus the Medigap plus the lower, exactly, per person. So, you're ticking up close to 1,000. Now that's Medicare, but let's say you're age 63, not Medicare eligible yet, and that there's no option through your employer to have any kind of subsidy towards that health insurance. I mean, if you have to go out to a private plan, because again, you've got assets, you've got income coming in from pension perhaps or retirement, you could easily, in those mid 60 years before Medicare, be looking at $800 a month, easily, if not easily. $900. So we just want to put that out there. I'm sure any one of us could have a day we're like, oh, I just want to talk about retirement, think about retirement. But I can't stress enough, Liz and I will take a deep breath and say, okay, let's see what that looks like. And
it's just doing the research and having the information ahead of time. So again, if we have a lot of folks on here from Northrop Grumman. And so, you call benefits and you say, hey, if I was to retire, you have to do it within 90 days. What would my retiree medical coverage look like? Now, this is pre-65, and they can give you an estimate as if you were going to retire in the next 90 days. It's really good information to have for planning.
Just
in
one
general.
other on that, because we are winding down the year, then they usually say, but call us back in January because it may be a different cost.
Right.
Right. Moving
All right.
along
So
here.
Medicare Advantage, and again, this slide versus the last one, and people say, well, why the heck wouldn't I just do Medicare Advantage? So Medicare Part C is going to wrap Medicare A and B together. And again, that's where you see that 170.10 figure, and then they charge this additional plan premium, and the average is $19. So all in, you're looking at a difference of, you know, what is that, $100+ dollars? No, almost $200 per month difference. And again, just keeping in mind, looking at the difference of coverage and what is not covered, and are you comfortable being more limited to the doctors and services that are provided. So again, at first glance, if you're just looking at numbers, Medicare Advantage is oftentimes going to say, well, wow, that is dramatically different and much cheaper, and I'll just go that route without really understanding all of the benefits. All right, this is really important and something that Marge and I talk about weekly, if not daily. So this is looking at that income adjustment. And income, just thinking about your retirement paycheck. So I hope I don't go too far down the rabbit hole, but think about your retirement paycheck. And so most of us will have Social Security. Most of us, well, some of us may have pension. So pension is fully taxable. If you are single, over $25,000, and if you're married, over like $44,000 of taxable income will also kick your Social Security, 85% of your Social Security, to be taxable. So pension, fully taxable. Social Security could be taxable. And then the majority of us have been saving for decades, likely, into this pre-tax 401k IRA bucket. And so every dollar that's pulled out of there is considered taxable income and filters into this chart down here. And so it impacts, if you're taking these big distributions from your IRA, well, that could also impact your monthly Medicare premiums for the entire year. And it's both you and your spouse, because it's done by joint taxes. So even if you're only pulling income from your IRA, let's say the husband's IRA, not pulling any income from the wife's IRA, it still is joint income. So both of your Medicare Part B premiums would be increased to the tune of up to $578 per month per person. So again, you can see the jumps, and you can also see the tiers. Usually file joint tax return 182 or less, then you're at that 170. But then the 182 to 228, I mean, that's not a huge that's not a huge gap. And so then you're paying, you know, $68 a month more, then you're jumping to $340. So you want to keep an eye on these income tax brackets. And this is where planning, Marge and I often say, one thing begets another. And so it's not just this clear-cut shot of, yeah, let's do a big fat Roth conversion, because that's going to impact this too, because that's a taxable event. I am getting a little bit in the weeds, but so let's just say you're retiring, and these incomes are based on 2 years prior. So for 2022, it's based on 2020 income. So there's a form with Medicare that can say, hey, well, my income in 2020 was really high because I was working, I got some incentive pay, I got a bonus, whatever happened. Then you could say, but now my income is dramatically different. So then you can file a life event form, things like death, retirement. Those are life events, but Roth conversions are not. IRA distributions are not. So you want to be very cautious on how you're taking money out of your nest egg, where you're pulling it from, especially if you're flirting with some of these lines, because once you're over that limit, you're not going to get that money back. You're going to pay that for an entire year at least. All right, enough on there. So Part D, premiums are set for the policies that are offered. If income is above a certain limit, exactly like we just looked at on that chart before, then you will pay additional, and then you're locked into that premium increase for that entire calendar year. And again, you can see here, it could be just the flat, whatever the plan is, up to an additional $78 at most. But these add up, and why we want to be mindful of what your taxable income is going to be in retirement. So just some real life example. Mary retired at age 65, $70,000 annual income. So she's under that limit. Original Medicare with Part D and a Medigap. All in, she's about $314 per month. Medigap covers co-pays and deductibles. She pays for dental and vision and any long-term care costs on her own side. The Medicare Part D at $0. I mean, there's no Part D plan, so I'm assuming she just does not have a plan. There's no Part D that's free. So let's just be really clear on that. This is another example. Again, David is single, retired, age 68, $130,000 of annual income. You can see he's paying that increased premium. So Part A is still free no matter what your income. And then Part B is $340. And then average plan for Medicare plan is $19 for the Part D. So $352. His out-of-pocket expenses include co-pays because he does not have the supplement. So co-pays, he pays for dental and vision, any long-term care, and he pays out of pocket when he's out of his network because he's on the Advantage plan. All right, so this is the part that I think gets people super confused. I want to be really respectful of time. Thank you all for jumping on here. So if you are taking Social Security, there is an auto enrollment at age 65. So there's a 7-month enrollment period. It's 3 months before you turn 65, the month you turn 65, and then 3 months after. If this deadline is missed, then you, and by missed, even if you're not taking Social Security and you're retired, you're not covered on a qualified plan, then 65 is your number. So if you're retired, you're living off dividends, not taking Social Security, 65 is your date. You want to turn social or Medicare on at 65. If you miss this, you have to wait until general enrollment January 1st through March 31st. So open enrollment is what we're in right now, that where you can change plans. General enrollment starts January 1st. If you're covered by a qualified group plan, and this is really important to understand what is a qualified group plan. I believe it's any company with employees over 20 employees. If you're unsure, call your HR team. But for most folks who are working, your plan is a qualified group plan, and they have gotten much better. And again, I'll continue to pick on Northrop Grumman. Fidelity has gotten much more familiar with the form that provides, if you go to retire and you're 68 and you have to go to Medicare and say, no, I had a qualified plan, they have gotten really good about just emailing you that form day one. If you're beyond 65, you're still working, you're covered. You can sign up for Part A, Part B anytime. We kind of touched on that. Again, A is free. If you sign up for Part B, you're going to start paying for it. And again, it's income-based. So it's really duplicate to what you have through work. You may not need to do that. At whatever point you decide to retire, you have an 8-month window after you retire. So let's just say you're retired, December, then you have until August of the following year to get coverage in place through Medicare. You will need that letter in hand from your employer that says we had qualified coverage. COBRA and retiree plans do not count. So oftentimes, which is, 10 years ago, COBRA was prohibitively expensive. Now Marge and I are seeing where it's pretty competitive with these retiree plans, and oftentimes you're not restarting your deductible period. So COBRA may be attractive, especially if you retire, let's say at 63. You may say, hey, I'm going to carry myself for this 18 months till 65. But just know that you cannot go on COBRA beyond 65 and count that as your qualified coverage for the 18 months they give it, and then say, okay, now I'm going to go to Medicare. You have to stick within that 8-month window.
Yeah, I'm just going to throw this out there because we do have this come up periodically where one spouse will jump on the other spouse's health insurance for some period of time. So again, any of those, it's certainly worth looking at. Is it going to be cheaper for some period of time? But just being cognizant of, well, does that count or does that mess me up on the Medicare side? So just wanted to throw that in there.
All right, so Medicare supplement enrollment. One-time 6-month Medigap open enrollment starts the first month you're 65 and enrolled in Part B. So this, again, is traditional Medicare. once you're 65, you have to be signed up for Part A and B to get a supplement plan. This period provides guaranteed right to buy any Medigap policy regardless of health. And again, that's what Margie and I really want to make sure is understood, that it's guaranteed to get it. You have to be able to get coverage no matter what with a Medigap policy if you make it in your initial open enrollment. Once this window is closed, you can change plans, but again, you're going to be subject to underwriting. Very important. Again, our health is our biggest gift, not something we can control. Oh, totally. Prescription drug enrollment. Again, this is the initial open enrollment 7-month window, 3 months prior to 65, the month you turn 65, and 3 months after. And this is what you can change October 15th to December 7th. So this is where you can make some changes right now. And yes, it's 1%. So Medicare Part B, this is confusing. Margie and I were going back and forth on this earlier. Medicare Part B, if you delay signing up for that, it's a 10% per year penalty. 10% per year penalty. So if you wait 10 years, it's a 100% increase for the remainder of the time that you're going to be on Medicare Part B. Part D is a 1% increase for every year. For every month. So it's really 12% per year, which is crazy.
These are big penalties.
Yeah. So again, you want to make sure you have the enrollment periods, understand them. And the prescription drug enrollment also applies if you work beyond 65. Then same thing, you have that initial open enrollment period at that 8 months after, once you get signed up for Part A and Part B, if you're going that direction. All right, so once covered under Medicare, enrollees can change plans. You can go original Medicare to Medicare Advantage back to original Medicare, Medicare Advantage to Medicare Advantage, Part D to Part D. All of this is where we are today. And again, our big disclaimer here is that if you don't go traditional Medicare route, or you go traditional Medicare, original Medicare is the same thing, to Medicare Advantage, and then eventually you say you want to go back, to go between them, you could go through underwriting. Now, one thing, this is not a scare tactic. My dad's 73. He does not really go to doctors, and he actually just switched his Medicare plans. And I was like, well, Dad, I'm kind of nervous because you don't go to the doctor, but the underwriting was not terrible. Now, granted, he doesn't go to the doctor, so we don't know if anything's wrong. But my point is, I'm not saying that the underwriting has to be scary, but we just want to make sure that people know it's there, because I think it's something that's not talked about.
Yeah, and especially if there are pre-existing conditions.
Right, exactly.
Which as we get older happens.
To the best of us. All right, here's our summary. I just sat down with a client and she said, I work with a guy who, he's a Harvard engineer and he says that he can't figure out Medicare. So I don't blame him, and it can be very confusing. This is probably the simplest and most important chart to keep on file. Initial enrollment, 7 months around your 65th birthday, and it's going to avoid penalties for late enrollment. Special enrollment, that's I am working beyond 65 and I have qualified coverage. You have to do it within 8 months of retiring. Open enrollment is October 15th to December 7th to shop for better plans. General enrollment, not on here, but it should be. If, again, you miss that initial open enrollment, is that January 1st through March timeframe. Any other questions on this one?
I think we're good. All right, so let me just do a quick summary here. And it really is about considerations. We're going to follow this up to all the attendees so that you have a lot of the data points here and the time frames. And I do want to stress, we are not holding ourselves out as Medicare experts. You have, through the government, you have resources, and even, again, back to my handy dandy book here that Liz said we can get online. There's a state health insurance assistant program with a 1-800 number. So there's a lot of resources. Just go to your ssa.gov and poke around in there. And while you're there, if you have not already set up your Social Security online to pull those old green and white statements, that's how I refer to them. and make sure you have looked at your Social Security benefits and think about what those penalties are for taking early. So just wanted to put that out there. Back to the task at hand, here are a whole list of considerations. Thinking about your healthcare needs or those of your loved one, what plans cover those services, if there's any other coverage out there, the cost. We went through where those costs are today. Again, that's all available online. I can't stress enough how important it is to look at the IRMA. Just remember your favorite Aunt Irma. And remember, it looks back 2 years prior. That's what the cost is predicated upon. The choice of doctors, hospitals, maybe you're in top health and it works for you with the Medicare Advantage, which is synonymous with the Part C, prescriptions, drug coverage. I see ads for this all the time, or even when I go into Sam's Club. You can take, I believe, prescription list and put those out there to find out which of the different drug carriers are going to have better, well, more cost-effective cost for those. And then the quality of care, obviously, that's important to all of us. Convenience, travel, this all weighs into these Medicare decisions. And I mentioned some resources, so I'll leave this up here for just a minute, but this will be provided to those attendees with our follow-up. And give you a minute there. And I'm just going to close it out with a big thank you for attending, and a thank you to Northrop Grumman Federal Credit Union for putting this out to members. We thank our Blue Heron clients for attending today. If you have follow-ups, you can send an email to Debbie here in our office at debbie.schilling@lpl.com. And feel free to check us out on our website right there, blueheronfinancialgroup.net. So that
And
covers.
sorry. I was going to say, more than anything, we want to be a resource. You know, Medicare is such a big part of retirement planning nowadays, more than ever, and probably not going to change. So we just want to hopefully provide some insight and education around things that you should be thinking about as you lead up to and into retirement, and hopefully take some of the guesswork, some of the stress out of it.
Great. And I'll just leave this up here for another minute so that you can grab that. And we do have a couple hands coming up. We're going to just ask you to please go ahead and